Dear attendants on the World Conference on Qualitative Research, I'm Elena Torralba, student of a doctoral program at the Autonomous University of Barcelona. Breast cancer was the most frequent among Spanish women in 2018. The psychological anguish of facing the disease is mediated by different factors, including coping. Coping is understood as the ability to handle the demands arising from stressful situations such as breast cancer. For this reason, the main objective of the study was to understand the evolution of coping strategies through the disease process and the role in adaptation to breast cancer. A qualitative interpretative study was carried out taking phenomenology as a theoretical methodology approach. The study population was women diagnosed with breast cancer in 2016 at the Sant Pau Hospital in Barcelona. An intentional sample with theoretical representation was established. As can be seen in the table, the estimated sample size was 12 participants, and the final number of participants will be determined based on the saturation of the data. A semi-structured interview was used. The interviews were conducted by a nurse with a research profile. We performed an analysis of thematic content assisted by Nvivo 12 program. The analysis process was carried out in three phases. First phase, the transcription of the interviews. Second phase, the interviews were categorized and codified. Third phase, the relationship of the categorized was explored using coding matches. As for the results below, we will then dynamically and visually expose the evolution of coping strategies through breast cancer. The image shows the course of the disease as a journey through different slopes of a mountain. The diagnostic or acute phase of breast cancer is identified as a result of stress, good prognosis, and uncertainty. Multiple coping strategies are identified, and the strategy of accepting responsibility appears exclusively in this phase. In the extended phase during treatment, the disease is associated with self-care and caring for the other, but also normality. In this phase, strategies of seeking social support, distancing, and planning predominate. And finally, in the permanent phase, the disease receives meanings such as distress, recurrence, survival, or consequences. The exclusive strategy of this phase is positive reprisal. However, the strategy of acceptance of responsibility does not appear. In addition, the predominating strategies in this phase is that of distancing. To conclude, we will determine the three main ideas from the preliminary analysis. First, coping strategies are diverse in each phase, and each woman uses one or even several at a time. Second, although it is not possible to determine a common pattern, there are certain meanings that are associated with the use of certain coping strategies in each phase. And third, therefore, it is necessary to continue researching the phenomenon of coping in women with breast cancer to understand the changes through the disease. Thank you very much.